back to the Recovery Lab. This is Mike. So we got a very special episode for you guys today. We're going to go over what are trigger points. So just before we get started, I just wanted to say definitely working hard on the YouTube thing. Going to try to put more effort into the production quality of these videos. So getting a lot of feedback from you guys has really helped me kind of put together some material that I think you guys are really going to like. So normally what we do is our session sit-in series, where you see me work on somebody in real time. Today what we're going to do is we're going to kind of go over some of like the foundational knowledge that really will help you when it comes to, you know, improving your soft tissue, your manual therapy game. So one of the questions that I get a lot is, what is a trigger point? And what are trigger points? Why are they there? Why do I keep getting them? And this is a really common question that I get from clients, from students, interns, other coaches, etc. So what I'd like to do today is maybe kind of shed some light on why trigger points occur, what exactly they are from a physiological standpoint, and kind of what are some of these little tools that we're going to use to address them, okay? So let's get right to it. So what happens with these trigger points, right, is as they kind of build up in the tissue, they create a lot of metabolic waste around them, right? So let's just say these little bunches in here where the sarcomeres are all in that shut-off position. This is our trigger point, okay? So what happens is basically they get choked off. You know, there's all this metabolic waste starts to build up in the area. You know, there's a lot of reasons why that might happen, but you know, essentially the blood flow gets restricted, and now your body's kind of begging for a little bit of attention here, okay? So the only problem with this is you start to stretch this out, and all you're really doing is stretching out the contractile fibers around the trigger point, right? Those things are slammed shut. They're not going to move anytime soon. So now I kind of wanted to talk about why. Why do we get these trigger points? And I think trigger points are really aptly named because, to be honest with you, we really don't know 100% without a reasonable doubt exactly the cause of trigger points. If we did, obviously we'd probably have a better way to kind of intervene with these things. But I think it's aptly named trigger points because it can have a lot of different triggers. And what you'll commonly see, and what I'm going to share with you right now is kind of what I commonly see from a manual therapy perspective of like the top 3 reasons somebody will get a trigger point. So the number one reason that I see it a lot in is in older clients, okay? So as we age, if you're not using your body in some kind of athletic way, and it doesn't have to be sports related, just moving in general, as we get deconditioned, it's really easy for our bodies to kind of start to lose that tension or that ability to create tension and kind of keep us going. So you'll see a lot of times in older adults and people who sit at a desk all day or are generally deconditioned is that they have a lot more trigger points kind of within their muscles, and eventually that'll start to create some pain. You know, talk to anybody that sits at a desk for 20 plus years, and I guarantee you start rolling through their upper traps, you're going to start to feel some trigger points because they're in that chronic, like, sitting forward head position, and then their body is just going to say, well, we don't have the capacity to kind of hang on to this anymore. So what we're going to do is going to start to like riddle this upper trap or some of these other shoulder stabilizers and neck stabilizers with trigger points, okay? And that can definitely be painful, and it's definitely a chronic health issue in this country now. The second thing that I see the most common is people who struggle with some stability issues. For example, you know, if you have an unstable shoulder for whatever reason, let's just say you dislocated it, you had a traumatic injury, or you're just one of those people that lives on that hypermobility end of the spectrum, you'll tend to see that those people kind of present with tightness in their rotator cuff or in their shoulder in general. And this is where you have to really be a good evaluator and really take a good history, because if this is somebody that has chronic instability or is hypermobile and they're feeling tight, it's not because they are actually tight, it's because their body is trying to create some stability. So, you know, again, using that shoulder as an example, if that ball's just banging around in the socket, in order for that cuff to kind of impart some kind of stability control on that, it will lock up some of those rotator cuff muscles, and you will, you palpate along an infraspinatus on anybody with chronic shoulder instability, and I can guarantee you it feels like cooked bacon. It's really tight, it's really dense, it's probably loaded with trigger points, and yes, I believe that you need to address that, because that's a tissue quality problem. So you need to address those trigger points and release them, but then not stop there. You know, resetting that muscle or addressing that tissue quality just takes care of what has been done in the past. It just takes care of the damage that has been done. It doesn't fix the problem permanently. So again, we'll have to save that for another video, but you know, we want to pair these manual interventions with the appropriate corrective exercise, stability training, what have you, depending on what our movement hypothesis is for that client. So the third reason that I see a lot of trigger points in some of my clients and athletes is if they have a movement compensation or a movement dysfunction. Okay, so let's just say that this person's 100% healthy, they don't necessarily feel any pain yet, but you do an FMS or a movement screen with them and you notice that, man, this person kind of doesn't move well at all, so maybe they have some mobility restrictions, they have some motor control issues. These are things that if you really then do go to a palpatory exam or a table exam and start kind of feeling through where you think they're tight, I'm going to guarantee you're going to find some trigger points kind of laid in that tissue, okay? So, again, our bodies are compensation machines. This is why we're the dominant species on this planet. Not because we're the smartest, right? It's because we adapt the best. We do it better than any other species. We compensate the best. It doesn't take us generations to do it. We can do it in the matter of days, weeks, and months. Okay, so if you're somebody who's got some movement issues, it's really important to get yourself evaluated and start addressing those issues now, because I can guarantee you that even though you don't feel pain right now, you reinforcing those bad movement patterns is going to eventually reach a point of threshold where the tissue just isn't going to work with you anymore, and it's going to start to let you know via pain in the brain, okay? So those are really the top 3 reasons that I see people with trigger points, whether that's in a rehab setting, a performance setting, or just a general, tissue quality kind of sense. All right, guys, so this is going to be kind of like the last little installment of this video today, and we're going to talk about kind of how we address trigger points, or at least what are my go-tos for treating somebody who's got chronic trigger points or chronic tightness in their muscles, okay? By no means is this an exhaustive list. There are so many modalities that you could use for this. These are just the modalities that I use and the ones that I kind of use as like go-to. So the first thing that you need to do is you need to educate clients, okay? That's the number one thing. That I'm hoping that this video might shed some light on how to do that with your clients if you're struggling with maybe how to explain, hey, what is a knot in the muscle? It's not an actual knot, right? We already kind of went over, how those sarcomeres kind of get shut down and closed off, and how we're going to now address that. Okay, so first thing is client education, and I like to teach them self-myofascial release techniques. Okay, so I used to use lacrosse balls a lot, played Division I lacrosse, so I had a lot laying around. I've kind of moved away from some of the harder balls like lacrosse balls and golf balls in lieu of some of these more soft therapy balls. Okay, so these are the Yoga Tune-Up fitness balls. I really like these because it's like a sponge ball. Okay, so it's dense, but it's got a little bit of give to it. Okay, this is really nice because it's kind of forgiving. Okay, so let's just say again, let's go back to that rotator cuff example. If you're kind of rolling through an infraspinatus and you bang over that scapular spine with like a hard ball, it kind of really hurts to hit that bone. With this, not so much, right? So there's a little bit more margin for error when you're using a ball, okay? And again, when I teach people how to do this, it's not just kind of roll through as fast as you can. I teach them to kind of scan the tissue, right? I tell them you're on a seek and destroy mission, all right? We're gonna find these tight, painful spots, right? Trigger points. We're gonna find that trigger point and we're gonna hone in on it and we're gonna kind of massage back and forth over it a little bit at a time. Okay, so whether I was rolling on the table, let me move this up out of the way for you, whether I'm rolling on a table, whatever it may be, I'm going to find that tight painful spot and I'm just going to kind of work back and forth, right, creating some blood flow, bringing some neural stimulation to this area and kind of releasing that trigger point so that I can restore normal function and then move on to my, stretching or corrective exercise program. Okay, so number one, client education. I really like these Yoga Tune-Up balls. You can definitely check them out online, but anything will work. I've kind of moved more towards these softer balls for that, okay? The second thing, my second favorite modality is these guys right here, my hands, okay? So this is for something if I don't have time to work on somebody, but I want them to be proactive during the week. But when I see them, the first thing I'm gonna assess them with and treat them with is my hands, okay? And the advantage there is that when you're using a ball or a foam roller or a massage stick, you feel where it's tight. The ball doesn't feel it, right? So for me, I can feel where you're tight too, right? Because my evaluation tool is the same thing as the treatment tool, okay? So trigger points are tricky little bastards, okay? Sometimes they need a lot of pressure, sometimes they need very light pressure. Everybody's a little bit different. It really depends on A, your tissue quality, B, your activity level, C, where in your body your issues are. But the beautiful thing about a skilled clinician is that I can feel where you're tight too, okay? So I can kind of adjust the amount of pressure that I'm putting on that trigger point, kind of sense what the nervous system wants, what the body wants, and kind of hone in on that. And I can get a much more effective release than you could probably get on your own with the ball. Not saying the ball's not great, just saying I'm a little bit better, okay? All right, so my hands, again, that's why if you watch some of my session sit-in videos, you will always see me working an area with my hands first. That's where I do a little bit of my deeper work. I hit those deeper muscle layers, right, because I have a lot less surface area on my fingertips and my hands and my elbows than, let's just say, a foam roller or something bigger, okay? So the third thing that I really like, and anybody who's watched any of my videos will know this, is this guy right here, okay? Instrument-assisted soft tissue mobilization. If you don't know Graston or ISTM, whatever you want to call it, instrument-assisted soft tissue work, learn it. It is by far one of the most effective treatment modalities that I've come across in 10 plus years of being an athletic trainer and a manual therapist. There are a lot of people out there who are a little bit purist, shy away from the instruments. I also see a lot of people not using the instruments appropriately, okay? You don't need to crush people with these. This is not like more is better, right? Better is better. Again, you've heard me say this before in some of my other videos if you've watched, but my take on the instruments is they give me a mechanical advantage on the tissue, okay? I like this for more superficial trigger points. I will use these very commonly in conjunction with some of my deeper tissue work with my hands as almost like a finisher for that body area, okay? So again, we talked about how these trigger points create toxification in the tissue. This is a great way to bring fresh blood flow to the area, okay? It's extremely effective, it doesn't take a lot of time, and you can really bring a lot of blood flow and oxygen and nutrients into this area and really kind of help your body deal with these trigger points on a more kind of blood flow or good stuff in, bad stuff out level. This is also going to help us with things like tissue quality in terms of fiber orientation and collagen production, right? So Graston or instrument assisted has been shown to kind of stimulate collagen production or fibroblastic activity, which is great. So things like tendinopathies or, you know, muscle strains, obviously appropriately timed in the healing process. Things like instrument assisted soft tissue work really does a great job. I do prefer stainless steel. I prefer steel because it has a better friction coefficient, okay? Plastic tools and traditional oxhorn tools, while they're a great place to learn, and that's how I learned, was with plastic. They're much cheaper and more inexpensive and much easier to get. But these are really easy to get too, and if it's something, if you're a manual therapist, you're going to add this to your repertoire, I strongly encourage you to buy quality tools and make the investment, because they will pay you back on the back end tenfold, okay? Especially on the wear and tear in your hands, okay? So stainless steel, it'll get you more treatment time per, you know, session with your clients versus the plastic, which will bring that skin to threshold a lot faster. Again, that's just my preference on Graston. We'll do another whole video on kind of the comparing and contrasting some of the other tissue tools that are out there. Number 4, cupping, okay? Cupping is something that I've added to the Recovery Lab kind of repertoire relatively recently, within the last couple of years. I have like a regular manual cupping set. But when I'm finding like really deep trigger points and deeper muscle layers, or areas that are like postural muscles, I find, again, this is my personal opinion on it. This is by no means is an exhaustive list of when and how you should use it. I'm just sharing with you how I use it in Recovery Lab. Okay, so again, I already know I'm probably gonna get trolled on some of this, but listen, again, this is just how I use it in my opinion, and by all means you can do it the way I do it, or you can go ahead and get your own information from elsewhere. There's plenty of great info out there. So again, with the cupping, I like it on these areas of like postural muscles like upper traps, paraspinal muscles, you know, thoracolumbar fascia, like thick fascial sheets, okay? I find that works really well to kind of create some blood flow, and it's just a different way to speak to the nervous system, okay? You know, a lot of these other modalities are compressive modalities, right? We're compressing the tissue. This is a traction force, okay? So we're just speaking to the nervous system on a little bit of a different level. I do find my clients really like the cupping, but, you know, it does leave those dark circles. It will show you, you know, tissue stagnation, things of that nature. I'm not somebody who, you know, puts a lot of stock in that, although I know there are clinicians that do that, and they're wildly successful at what they do, so tip the cap, you know, but this is just how I use it. So the cups, again, very low risk, okay? This is extremely low downside stuff, with the exception of the dark circles that you're gonna get as a remnant. So something I like to try on my clients first. I let them know, hey, you're gonna have some dark cup circles for up to a week, you know, are you cool with that? And most of the time people are cool, they just wanna get better. So cupping, definitely give it a shot. Again, very inexpensive to get started with this. Plenty of great information out there on it. So I hope this helps, maybe inspires you to go out and get a cupping set and give that a try. Number 5 for me is kinesiotaping or rock taping, okay? I prefer rock tape, okay? I am a rock doc. I'm certified through rock tape. Full disclosure, you guys deserve to know that. So I do get discounts on the tape, which is why I choose this. But I really do choose this tape because of its quality, okay? It's a really good quality tape, okay? There's plenty of other cheaper brands out there, but you do get what you pay for, and I find that with the rock tape, I'm getting much longer tape duration, and that it also, you know, it's very accessible and easy for me to get, and it has, you know, great colors, all these different things that people like. So what I'll do with rock tape, again, in conjunction with some of my other treatments, as a finisher, okay? So if I've just worked on an area and done some deeper work, some Graston, maybe some stretching, whatever it may be, I will frequently throw the rock tape on there after as a way to augment my treatment for the next few days, okay? So 3 to 5 days is what they'll say. I've had it last for up to a week, maybe with the exception of some of my swimming athletes, but or my tri people. It's definitely a great modality. Again, I kind of treat this as the same way I treat cupping. I talk to people about it. I tell them why I like it, just like I'm telling you right now. And I want them to give it at least one try, okay? And if they don't like it for whatever reason, we don't do it again. But I do like people to try it because it's just another tool for the toolbox that can really help kind of increase blood flow, kind of allow some more fluid dynamics in the tissue, and it's kind of a really nice feel-good thing, stimulate the sensory system. I find I have a lot of success using the rock tape with my athletes, okay? And the last thing I'll talk about is like your basic percussion massager, okay? This is a very basic one, okay? I am interested in actually, you know, upgrading this to a wireless model like a Theragun or something like that. But I have this percussion massager, okay? Pretty standard. I like this because, again, you know, sometimes if you want to do some lighter work, if it's somebody who's extremely sensitive to tissue work and they have a lot of pain and discomfort with it, I will frequently hit them with the thumper or the vibrating massager first to kind of desensitize these areas. I find that especially with my deconditioned folks, some of my older adults that have had chronic pain issues for a long time and they're extremely tight, I find that hitting them with this first kind of softens some things up a little bit, gets that blood flowing, and it desensitizes them to a little bit more of my other manual techniques, okay? So again, thank you guys so much for coming to visit me in the Recovery Lab. I really appreciate it. If you like what you see, please remember to subscribe, okay? I want to keep this YouTube channel going. You know, you're going to start to see some more stuff from TJ and Kyle out on the performance and the nutrition end, which would be really cool, but we want to kind of bring to you guys a lot of different perspectives in performance training, rehabilitation, reconditioning, in addition to like the manual therapy stuff. So if you like what you see, please subscribe. You can follow me on Instagram at MikeStella_ATC. You can follow AMP on Instagram at AMP_athlete. Definitely check out the website for more information, www.ampathletes.com. Trying to think anything else. Definitely going to get back to some more session sit-in videos, but I kind of really like taking the opportunity to kind of sit down and talk to you guys about kind of like the ins and outs of Recovery Lab and what I'm doing in here. So if you do have any questions, please leave them in the comment section below. I will 100% get back to you. I will answer them. Email me, DM me, whatever you want to do. Get in touch with me in some way. I'd be happy to start a dialogue with you and talk about your issues or whatever you may have, and even maybe I can refer you somebody in your area. So thanks again for visiting me in the Recovery Lab, and we'll see you guys next time.